I am speaking to our State Senator Bruce Tarr, as I do every week. Hi, Bruce. I see you are in a new place.
Hi, Heather. Nice to see you. And I want to compliment you on that beautiful Christmas tree that's behind you in the shot.
Thank you. Thank you. But tell us why I'm seeing something different behind you today.
Well, so I'm coming to you right now from my home as a result of the fact that I have to be quarantined because I was exposed to COVID-19 in the Senate chamber because of a colleague who sits near me in the chamber. And the way that the protocol works is I had a test initially that was a positive, but then I had two subsequent negative tests that are the PCR type, which are the more reliable of the tests, I'm told. But despite that fact, because I had a headache, which is considered a symptom when the tests were taken, I still have to quarantine for 14 days. And so I'm coming to you from a place that's a little bit different. I tried to put the flag in the background so it would look somewhat consistent, and also a little piece of art behind me so that it could be a little bit more visually appealing as I come to you here from my house.
Well, it looks great, but just tell me, you feel well?
I do feel well, and again had after what I consider to be a test that was false positive, and that was essentially confirmed by two subsequent PCR tests. Despite all that, I feel good. I feel like I do not carry the virus, but it's important that we all follow the rules. And these are the rules of the Department of Public Health that are being enforced by the Gloucester Board of Health, and I'm going to follow them.
Now, let's talk about the governor's proposed vaccine rollout.
So it's important that we be ready to be able to distribute the vaccine. And I know that today, as we're recording, there's been a discussion in Washington about the FDA approving the first vaccine for use in Massachusetts and in the country for that matter. So the administration, led by Governor Baker, had put together a plan that had to be approved by the federal government. It was. It essentially comes in 3 tiers. And I very rarely use notes, Heather, but I want to make sure I get this right. And so the first phase of the vaccinations is from December to February of next year. And that is going to prioritize healthcare workers that are dealing with COVID-19, that have to face it as part of what they do. Also long-term care facilities, rest homes, and assisted living facilities, because we've seen a concentration of the virus in those particular settings. Also police, fire, and emergency medical service personnel. We know that it's important for them to be vaccinated. And then congregate care settings. And interestingly enough, this includes shelters, but also correctional facilities, where again, we've seen some issues, particularly in Middleton, which is close to us, where there was just recently a second outbreak, despite the very best efforts of everyone there to control the transmission of the virus. And then we go to healthcare workers that are not dealing directly with COVID-19. So that's phase 1. And then phase 2 is from February of 2021 to April of 2021. And that deals with folks that have particular healthcare vulnerabilities, and also some other essential workers, such as those in early education and K through 12 education, grocery, utility, food, and agriculture workers, adults over the age of 65, and individuals with 1 or more comorbidities. And so that's a second group of people. And then phase 3, which is anticipated to start in April of 2021, will be for essentially everyone else. And so it's important because I know that we've all seen the news, and with great anticipation, we're hoping that this vaccine will become available as soon as possible. But it's important that we understand that it will take a while for it to be distributed through various segments of our population. But I think the good news here is that we are prepared for it. The state government has a plan. It will be prioritized according to some criteria that make sense, in my opinion. And once the vaccine starts to flow, it will happen in our state. And I really think, Heather, that that is a bit of light at the end of the tunnel. We still have a long way to go, and folks are going to still need to wear masks and sanitize and be socially distant for a while. but at least we have the hope of developing so-called herd immunity and community-wide immunity so that we can fight back against this insidious virus.
So Bruce, there's been a lot of conversation about, is there enough vaccine? Have you had any conversations with the governor about the amount available?
So I have been, and in speaking with the governor and our Secretary of Health and Human Services, Mary Lou Sutters, it's my belief, and I think it's their opinion, that there is not enough vaccine. We're hoping to get much more, but this is a situation where we'll take what we can get and try to get more and continue to vaccinate as we go. But I certainly think there could be much more vaccine. And I think everyone in state government, at least, is hoping there will be as soon as possible.
And I just want to repeat, I think a lot of people know this, but as I understand it, the vaccine is free, right?
That's correct.
And people will need 2 doses.
Mm-hmm. So there's, they will need 2 doses. There is, I'm told, a third vaccine that's being considered that may only require 1. But right now, what we know is the doses are required to be 2, and there has to be some time in between the administration of the first vaccine and the second. And one issue that's arisen that is being addressed is making sure that folks that get the first vaccine that's one type gets that same type for the second vaccine. So tracing that is going to be very important so that we don't have folks getting one version and then a second dose of another version, because I'm told that would not be effective. And in a related issue, I've also asked to make sure that we can trace adverse events so that if we have a reaction that people begin having, that we can keep track of that and know how to address it before it becomes out of control. I don't think it will, but I think it's important that we be prudent and make sure we measure those kind of things.
And this is just simple mathematics, but I want to put out the fact that the governor apparently ordered 300,000 doses, but that only covers 150,000 people because each one will need 2 doses.
That's correct. Everyone needs to have 2. So the numbers that you're hearing essentially cover half as many people.
Right, at least in the beginning until the second vaccine is available. Right. So do you want to talk about the governor's rollbacks, because he's so concerned about the surge that we've seen recently?
So we have had a surge, and one of the things that's most concerning is hospital capacity. And we've seen a dramatic increase in the number of folks that are hospitalized. One of the things that I think that's changed is we don't see as much intubation as we did before, and maybe a little bit less intensive use of intensive care units, but we still don't want to overwhelm the capacity of our hospitals to deal with patients that have COVID-19. And so a couple of things have happened. The first that was most recently in the news is the governor worked with hospitals to try to pare back elective surgeries that don't need to be done immediately. So that would preserve some capacity. But the more broad-reaching initiative was to roll back the reopening program so that we'll now be going from, for every community, from phase 3, step 2 to phase 3, step 1. And so that has implications. I won't get into all of the details here. I think we're all familiar with what it was like under phase 3, step 1. It doesn't mean a complete shutdown of things. It means some changes in how we do things and changes in the gathering limits and so forth. But it's meant to be something that will help us get to a time when we are in a much better place with regard to vaccines. We are in a very, very challenging time right now. I would argue that we've seen the results of gatherings around Thanksgiving, and because the weather is colder and people are gathering inside spaces that are more conducive to transmitting the virus. We're in the season of Hanukkah and Christmas, and so we're likely to see more of those types of gatherings. And so we need to be prudent. We can see light at the end of the tunnel, but we still have to be able to get through the tunnel. And so that's why this is happening. It goes into effect on December 13th, which will be Sunday. And we certainly hope that everyone continues to be prudent. I know we're all suffering from so-called COVID fatigue, but we're in the late innings of this game, and we need to continue to do the right things to protect each other so that we can get to a better place.
Hmm. So I know that one important subject on your mind right now is the police reform bill, and let's catch up on that.
So it is, Heather. You may recall that the Senate and the House had voted on a so-called conference committee report based on a reconciliation of a bill passed by the House and a bill passed by the Senate. That conference committee report, in my opinion, had several concerning issues. And I regretted to vote no, but I had to vote no to be able to expose those issues and try to move the bill to a place that is fair, sustainable, that is safe, which is very important. And I am very pleased to report that the governor is giving the opportunity for all of us in the legislature to be able to make some corrections. He has filed a series of amendments and indicated that he believes that the bill does need change. And I agree with that. But I would be very quick to say, I believe that we need a bill principally that provides certification for police officers and the ability to decertify those who act inappropriately. That should be our main goal. Unfortunately, other things got added to this bill that are problematic, that in my opinion, either deserve modification or more study. And my hope is that by the governor giving us a new opportunity to look at the bill, we will find the right balance so that we can have a bill in place and that we can secure his signature. We've still got a lot of work to do to get there, but I am hopeful at the opportunity that we have to revisit this matter very soon.
Well, as I understand it, the novel aspect of this bill is the commission that was formed, that would be formed. Do you have any concerns about this commission?
I do. There was an agreement back in June that was between the Black and Latino Legislative Caucus, which has been a major leader in this issue, as well as the Law Enforcement Policy Group, which is basically an umbrella group of police unions in Massachusetts. And one of the things that was agreed to was a commission to certify and decertify that had a balance half of civilians and half of people with experience in law enforcement. And unfortunately, the bill that was passed by the House and the Senate abandoned that concept and went with a much different ratio. One of the things the governor's amendments do is try to restrike that balance and be able to get some more law enforcement experience on the commission. Now, it's important for me to say that I do think we need civilian representation on this commission. And I think what was agreed to originally is the appropriate balance. And in fact, if you look in Massachusetts, we have about 30 different commissions that license professionals, such as the Board of Registration in Medicine or the Board of Bar Overseers for lawyers. And all of them have a majority of people who are professionals in the field they're regulating. Right now, the board that we have does not even have a balance of half and half. And so I think we've got some work to do here. I know that the governor has filed an amendment on this subject, and I'm hoping we can get back to what was agreed to and also what is fair for all sides concerned here. So I'm very optimistic, despite the fact that it's been a difficult road to get to this point.
So could you just tell me the direction of that amendment? The amendment comes back to the conference committee, is that right?
It actually comes back to the House and the Senate. Will come back to us in the Senate first, because we initiated the conference committee process. So it has to go to both branches, but there's a series of amendments, and they'll come to the Senate first, and then the bill will move to the House. And here's something that's very interesting to understand, that the amendments actually create a new bill. And so it starts the process essentially all over again. I don't think we'll go back to scratch here. I think we'll move forward with the elements that we have, but it reopens the bill to other amendments beyond what the governor has offered.
So we still have a ways to go with this bill.
We do, and that's something I've asked people to focus on. And I've tried to remind folks that I think all of us in the legislature have the same goal, but we want to get to a bill that has the right balance. And we've got another opportunity to do that, because the legislative process is intentionally long and arduous and calculated to be able to accommodate various changes along the way.
Well, thank you so much. It's always so interesting to learn about this process and to, watch it firsthand with you. So thank you. Do you want to talk about the ignition interlock device?
I would love to. So one of the things that I've been working on for the last several years is trying to fix a glaring problem with our Massachusetts laws around operating a motor vehicle while under the influence of alcohol. And that glaring problem is that for a first offense, we do not allow the registrar of motor vehicles to require that an offender that gets a limited license to also be required to have an ignition interlock device. And that's critically important because, first of all, we are the last state in the union that does not allow this particular device for first-time OUI offenders. We do allow it for second and third-time offenders. We require it, but we aren't using this tool. And there is a whole body of information, a lot of it coming from the Centers of Disease Control and Prevention, as well as Mothers Against Drunk Driving, which indicates that this is a tool that can save lives. This can prevent tragedy on our roadways. And in fact, I believe there was a CDC study that goes back to 2011, where they indicated that the use of this device compared with license suspension alone is 67% more effective at preventing drunk driving incidents. And there are other statistics that I could certainly quote, but I think the main thing is there is a broad consensus that being able to have this tool will save lives on Massachusetts roadways. And so as hesitant as I have been to see policy change in this budget, my belief is this is an urgent matter and it's a tool that we need. And I'm very pleased, number one, that the Senate endorsed this proposal unanimously when I offered it as an amendment. And then the conference committee also included it in the final version of the budget. And so it's now on the governor's desk. And I am cautiously optimistic that he will sign the measure because he also in the past has filed similar legislation. So I would never speak for the governor, but I know at least philosophically he's supportive of this measure. And my hope is that very soon it will be law in our Commonwealth.
Could you just describe the device for our listeners who don't know?
So I think the easiest way, and this is perhaps an oversimplification, is that it's a device that connects to the starting apparatus in your car, the ignition switch, and it essentially is a breathalyzer that measures your breath alcohol content. And if it is at a level which would impair you and leave you not able to properly operate a motor vehicle, it prevents the vehicle from starting. And I should mention, Heather, that the way that the legislation that I put forward reads is that it could only be required for someone whose breathalyzer reading in their first offense is greater than 0.15. So this is for folks that have committed a pretty serious first offense, and it would prevent them from being able to start their vehicle if they did evidence through a breathalyzer that's attached to the ignition switch, a blood alcohol level that would leave them impaired. Well, thank you, Heather. It's great to be with you. And again, great to see that wonderful tree in the background. And I hope everyone is having a good and safe holiday season. And I look forward to talking with you again soon.
Great. Thank you.
Thank you.